Welcome to the Emergency Medicine Residency Program at Sidney Kimmel Medical College at Thomas Jefferson University, also known as JeffEM. My name is Peter Tomaselli, and I'm the Residency Program Director here at JeffEM. And it's my distinct pleasure to welcome you today. If you're watching this video, it means that you have received an invitation to interview with us. And we're really excited to get to know you a little bit better as we meet one-on-one over the coming months. The purpose of this video is several-fold. Number one, to introduce you to our program. Number two, to spare you a little bit of time on interview day, as you can watch this video asynchronously at your leisure. And number three, to help you make the really important decision of what training program is right for you as you come upon this really exciting and important milestone in your medical education. Let me start by introducing our team at JeffEM. As I mentioned, I'm the residency program director here, and I've been in this position since September of 2023. However, I've been at Jefferson a good bit longer than that. I did my residency here from 2016 to 2019. I stayed on as a medical education fellow, faculty, APD, and now program director. And it's been a really wild ride for me. I'm blessed to be a part of this program. That's really special to me. And you'll have to forgive my bias just a little bit as I gush about what a great program it is. Having been a part of it as a resident and now continuing to direct it into the future, it is a really special program for me, and I'm invested in its success, as are these next few folks. So Doctors Erin Hogue, Abby Borowski, and Kelly Kim are our APDs. Erin and Kelly are graduates of our residency program, and Abby is a graduate of our medical education fellowship. We're really fortunate to have all three stay on with us to continue educating the next generation of emergency physicians here at JeffEM, as well as continuing to make our program the best that it can possibly be. Also joining us is Dr. Yvette Calderon, who's the chair of the Department of Emergency Medicine. Now, Dr. Calderon joined us in April of 2025, and she's a powerhouse, renowned throughout the country for her skills in operations, research, and education. She's also a member of the board of directors of the American Board of Emergency Medicine, and we're really lucky to have such a staunch advocate for graduate medical education, chairing not only our department, but the entire Jefferson Enterprise Emergency Departments. Lori Berryman and Mervyn Alexander are our residency coordinators. Now, you may have already heard from Lori as a part of your invitation to interview with us, but Lori and Mervyn not only keep the interview days running smoothly, but they also keep our residency on track with credentialing, scheduling, evaluations, and so on, all kept organized by these wonderful people. And they are whizzes and an indispensable part of our residency program. Speaking of indispensable, we have our group of chief residents, Steve Graver, Krishani Patel, Srinidhi Thirunagaru, and Tim Vaughn Ogunlusi. Now, these four are going to likely meet with you at some point during your interview journey, whether that be on interview day during the resident Q&A session or during one of the many socials throughout the interview season calendar. We hope that you'll be able to join us for one of these resident socials, as we think it's really important to get the resident perspective on what it's like to be a part of this program. And feel free to sign up for any date that's convenient for you. It doesn't need to be adjacent to your interview date, but whenever you can make it, we would love to have you. Now, I'll tell you a little bit about where we are located. So you can see us here on the map in southeastern Pennsylvania, right across the border from New Jersey. Now, more specifically, we're located in Center City, Philadelphia, in a neighborhood called Washington Square West. This is a really vibrant and diverse area in which to work and live. Many of our residents and faculty members live within walking distance and walk, bike, or scoot to work on a daily basis. It is a great place to live and to train with lots to do and something going on just about every night if you're in need of a little nightlife. And we do have 17 new interns per year. As you can see here, this is our residents on one of their retreats 2 years ago. Our residency classes are rather large in size at 17 per class, but they are remarkably close for groups of this size. Now, we are a 3-year program, which leaves us with a total of 51 residents in our cohort. Again, it is a fairly large group, but they all know each other very well and enjoy spending time together, whether it's at work or outside of work. We'll talk about a few highlights in our educational program here at JeffEM. Now, as a former medical education fellow myself, we know that the best way to teach is with multimodal education. And so we don't just stick with the standard didactic lectures, but we do mix it up with conferences, workshops, gamification, all of which are designed to keep you engaged and learning throughout this process. Some of the simulations that we've done have been masterminded by Dr. Lara Phillips, who's one of our wilderness gurus, including a wilderness race and a simulation on in-flight emergencies. And these are just some of the ways that we keep you really invested and excited about your education. Now, we'll speak a little bit about some of the clinical experiences that you'll have. The majority of your clinical time will be spent at Thomas Jefferson University Hospital. Again, like I spoke about, being right in the center of Philadelphia. This is a quaternary care academic emergency department. And we see everything that goes along with that. We are a level 1 trauma center. We're a STEMI and stroke center. We receive a lot of spine cases from around the region. And so it is a place where you can see kind of from the most simple all the way through the most complex patients. There are a number of other residency programs and fellowships throughout this hospital as well, and you get to learn from some of the best consultants in the country. It is a real privilege to get to work and train here, and you really see everything. Now, we know that not everything is academic, and you'll see a variety of emergency departments throughout your time here in residency, including at Methodist Hospital, our sister hospital in South Philadelphia. It is an academic and community hybrid. And during this time, when you rotate here as a second or third year resident, you'll be working as one resident with two attendings, and attendings will see patients on their own as well as with the residents. And it's a really great way to get to learn from sort of the communal nature of emergency medicine. We're all working side by side, talking with each other about interesting cases and not working in silos. In addition, it's great to get that community experience. You still have a number of consulting services that may come down and see the patients. And we do get transfers, particularly for hand surgery here. So you can see some pretty complex cases in that way as well. Now, we have some sites that are a little bit further afield, including emergency departments at Paoli Hospital in Mainline, which is sort of a more suburban, well-to-do area. We also have Mercy Fitzgerald, which is in Darby, Pennsylvania. Additionally, we have some pediatric sites, Nemours Hospital for Children, which is in Delaware, and you will do your PICU rotation there during your intern year. Also, St. Christopher's Hospital for Children, which is a community, more bread and butter pediatric emergency medicine experience, as well as Children's Hospital of Philadelphia, where you'll see everything from the bread and butter through the super complex. And then additionally, you'll spend some time at Jefferson Torresdale with their trauma team and their trauma ICU. Now, to break down what you'll see over each particular year, during your intern year, our focus is really on making you the best doctor that you can be. So it's really learning the basics of what it means to be a doctor for your patients and establishing really good habits. You'll have some time in the emergency department, a good bit of time, a full 7 blocks in the ED, but we are also supplementing that with additional specialty learning in various departments across the hospital. And so you'll get time doing EMS, ICU, cardiac care unit, OB, et cetera, all of which really serve to supplement things that you will be seeing in the emergency department and to help to lay the groundwork for the more advanced emergency medicine that you'll be doing down the line. During your second year, we want you to learn how to manage your flow and to find your niche. And so we do that by expanding the amount of time that you see in the emergency department. And during this time, you'll be tasked with being the senior resident on the side from time to time, where you are responsible for seeing a higher volume of patients and managing more critically ill patients. Additionally, you'll get what we call our procedure block or proc block. And during this time, you'll get to work with experts from ENT, oral and maxillofacial surgery, and ophthalmology to learn some of the other skills that in emergency medicine that we don't necessarily see all that often, and things that it pays to be really skilled at. For instance, how to do a comprehensive slit lamp exam, how to do a nasopharyngeal laryngoscopy. You'll establish those skills during your procedure block. Additionally, you'll be doing some more time in trauma at Jefferson Torresdale. You'll be spending more time in the pediatric emergency department at St. Christopher's Hospital for Children. And you'll also get what we call Teach Block, where you'll spend some time with third year medical students, both in the clinical environment and in the classroom, honing your skills and learning what it means to be an emergency medicine educator. Now, during your third year, we ask you to hone your leadership skills and to prepare for independent practice. And during this time, again, you'll see increased weeks of emergency medicine, but also some time as a leader in the medical ICU. You'll return to the ICU as a third year resident, working with an EM intern as well as an internal medicine intern, and be a part of the decision making process, making decisions for critically ill patients. Additionally, you'll continue with your teaching block and spend some time in the intensive care nursery, which has been a really valuable experience for our residents. Now, we do offer three fellowships, including ultrasound, medical education, and telehealth. And going along with that, we do have nationally renowned experts in all of these fields to help your education, whether or not you decide to pursue a fellowship in these areas. Now, where do you go after graduation? Our grads are really dispersed all across the country. Now, certainly there is a regional bias here towards the Northeast. Most people do stay in the area, but we do have a large number of folks that go to Florida, to California, to the Pacific Northwest. Now, this is just a sampling of residents that have graduated over the last several years. If you scan the QR code at the bottom left, you'll be taken to a Google Maps where you can find more specific information about where some of our residents have gone after graduation. Now, I'll talk to you a little bit about the city of Philadelphia, the place in which you are going to be training and working. So, the name Philadelphia comes from the Greek words philos, meaning beloved, and adelphos, meaning brother, hence the nickname, the city of brotherly love. Now, as a suburban New Yorker myself, someone who grew up in the New York metropolitan area, I always considered New York to be the best city on earth. And then I moved to Philadelphia. And it turns out this is the place that I could really see myself living and working and carrying out my career. It is a livable city, it's a walkable city, and something that I think felt really special to me when I became a part of this community. So we'll talk a little bit about Philadelphia sports, although it pains me as a New York sports fan to do so. There are a number of major teams. You have the big four: NFL, Major League Baseball, NBA, and NHL, including the Super Bowl champion Philadelphia Eagles. Now, because we do have the Philadelphia Phillies here, our residents do get to spend some time working event medicine. And so you get to work at the games, including playoff games, which can be quite exciting when the calendar turns to October and the Phillies are in the playoffs. Now you can see on the right side Gritty, who is the mascot for the Philadelphia Flyers. The name of the mascot really comes from the gritty nature of the city, I think, and he's a fitting mascot, something that the citizens of Philadelphia have really embraced as one of their own. Now, Philadelphia is a really good food city. It's certainly known for specific culinary delights such as cheesesteaks and pretzels and tomato pies, but it is also a haven for James Beard Award winners, Michelin starred chefs. There's a lot to explore here in the city, and the range, the spectrum of food that you can get around the city is really limited only by your imagination. There's a lot to do, a lot to see, and a lot to eat around here. Now, Philadelphia is also a cultural and historical powerhouse. On the top left, you have Independence Hall, which is where the Declaration of Independence was signed. But we have also modernized with the times. And you can see the Philadelphia Museum of Art in the bottom left with the infamous Rocky Steps made popular by the movie Rocky. And you can see just about every day people running up and down those stairs and taking pictures with the Rocky statue next door. We also have the Kimmel Center, which is home to the Philadelphia Symphony Orchestra. You can see ballets, shows, performances there, as well as the associated theaters throughout the city. And there really is something cultural going on every night of the week. And you can find a good touring show. You can find something that you love pretty much whenever you have time for something to do. Now, finally, I'll touch on what makes Jefferson special. A few things that come to mind pretty quickly about this. Number one, the people. And I know it may seem trite or cliche to talk about the people, but it truly is what's kept me here these many years. I've been here since 2016, and I feel like this is the place where I feel most at home when I go to work. I love getting to connect with our residents, who I think truly are special, but also our nurses, our techs, our environmental services folks, our unit clerks, all of whom really make the day special and make it an enjoyable place to go to work each and every day. Even when the work itself is really hard, it's the people that make it much more easy, and again, a special place to work. The other thing that I'll mention right now is the diversity of training experiences that you get while you're here. You get exposure to academic, community, and hybrid programs. You get to work in urban and suburban environments. You also get to work with hospital employees, contract medical groups, and small democratic groups. So that not only are you prepared from a patient care experience standpoint for when you leave here, but you also know what kind of employment model you want to work under. You are able to find a job that you really want to be at, perform well there, and to stick with it. And I think our graduates have had a really excellent track record of landing jobs that they love right out of the gate and sticking with them for a long time. And I think that's pretty special. We want you to be prepared for whatever life throws at you as an emergency physician. And I think our curriculum and our clinical experiences do just that. I could talk about this for hours, but I will leave it there and save some for the interview day itself. That said, if you have any questions, please feel free to reach out to us. Our email address is skmcemresidency@jefferson.edu. And you can feel free to connect with us at our socials at Jeff Emergency on Instagram and at JeffEMRes on Twitter or X. But we really look forward to hosting you for your interview day, and we hope that you will get everything out of it that you hope to. Please feel free to reach out if you have any questions, and we look forward to meeting you on your interview day. Take care. Thank you.